everyone. Thank you for joining us during your lunch hour at San Antonio Cosmetic Surgery, Dr. Baumholtz and Dr. Ortegon's office. What we are doing today is a live stream on laser hair removal. So it's the best time to get started because summer's about to come up. We want to reduce that hair, and that way you can have your legs, bikini line, underarms, face, arms. All those areas are ideal to treat, okay? And so you want to do that before you start getting in the sun. What we're doing today, we're going to be doing Miss Elena's legs, okay? And so we're going to do from the legs down. This is about a 30-minute treatment. We do avoid tattoos, okay? So the laser is looking for the hair follicles and pigmentation. So we don't ever want to go over a tattoo with a laser because it can definitely damage the tattoo, the art, and it can scar your skin, okay? So what I like to do is I will have her fold her leg out this way, and I will draw a few little lines just so that I can always make sure to cover all areas. So when we're doing the lower legs, we will do from the top of the knee down, okay? Thighs is from the top of the knee all the way up to the hip bone. And I'll just do that, okay? So we've outlined the area that I'm going to do to make sure I get good coverage. A little tongue depressor here. We use a clear ultrasound gel. What this gel does is we apply it to the skin, and the gel is a conductor. It helps transfer the heat through the skin, keeping the skin cool and not injuring the skin at all. And that way I can get the right setting for all skin types without burning the surface. So I'm going to go ahead and just apply a little bit of gel here. Just a real light film. And just so you know, I can treat all skin types, from light skin all the way to the darkest skin type. And that's a big deal with lasers. With laser hair removal and skin rejuvenation, we can do both here at San Antonio Cosmetic Surgery with our YAG laser. And so I've already set the settings according to her skin type, and we're going to get started. Now, if you have any questions, any comments, please ask, and I'll make sure to try to answer all your questions while we're on live, okay? So here we go. And do me a favor, don't forget to, let me start right here so you can see what I'm doing. Don't forget to comment, ask questions, share. We'd greatly appreciate it. Appreciate you taking up your lunch hour. As you see, she's not flinching, it's not hurting, you don't see any kind of redness. This is the Cool Glide Cutera YAG laser. So as I'm gliding over the skin, this has a cooling element right here. This is as cold as ice. And as you see, when I put it down, there's a little spot there. That's the spot size that I'm treating. And so as I slowly slide back, you see that if there is 1 or 2 hair follicles, it will zap it. If there's 5, you feel it a little bit more. You don't feel it too much. How do you feel?
I feel fine. It doesn't hurt at all. It's just a little zap, and it's not anything that's uncomfortable.
So Amy, we have a follower who says, how long before you see results?
Within the first treatment, you'll start seeing those results. It takes about 6 treatments to really see maximum reduction. So within the first treatment, you'll see that the hair will stunt the growth. So that definitely will slow down. The hair follicle starts thinning, and each time you'll get better and better results. The treatments are about 6 to 8 weeks apart, and as you see, I can see where I last went as I go little stripes down the gel area here, so I can make sure I get really good coverage. And so you see there's a, I don't know if you can see with the camera, but there's a slight little pink compared to here. But compared to the other area up here that I haven't treated, it's very slightly pink, but not much at all.
Now, do you have to shave before this treatment, or do you need hair? I mean, what's the protocol before treatment as far as shaving goes?
Okay, so you want to be shaven because you want the laser to damage the root of the hair. So it is ideal to shave the night before. You definitely don't want to be doing any kind of waxing, threading, tweezing, even Nair, any kind of creams that go deep into the skin and help diminish those hair follicles. All those treatments, you're kind of disturbing that root, and what we want is that root to be mature so that the laser can, that energy can absorb into that hair follicle and damage it. So as you see, we've already done almost half the leg of the lower leg here.
It's a pretty quick treatment. So how long does the treatment take if you were doing a full leg?
For lower legs, I would say you're going to be in and out in less than 45 minutes.
Oh,
of
wow.
course, everyone's legs are a little different. Everyone's tolerance is a little different. But you definitely, the contradictions for laser hair removal would most definitely be sun exposure. You don't want to be in the sun at least 4 weeks prior to your treatment. So when I say sun exposure, like you're wearing shorts, you're hanging out at the park, you're wearing a bikini, you're at the pool, or even working out sometimes, you know, if you're outside, you're a runner, those kind of things, you want to make sure that you stay out of the sun. Because this energy goes into that second layer of skin and is looking for that hair follicle, and it can give you up to second-degree burns if you have that recent sun exposure. So we definitely always follow protocol and ask, you know, make sure to ask you what you've been up to and if you're going to go be in the sun. And we try to make it as easy as possible for you to get through the protocol and through the treatment. So let me just make sure.
So after the treatment, Amy, are they allowed to wear shorts and be out in the sun after a treatment, or?
Yes, you can most definitely wear shorts and be out in the sun, but you want to give it at least 3 to 5 days. You have to remember that the heat does travel through the skin, and it can make the skin a little sensitive. So you know, you want to keep that in mind and take care of your skin so that we don't burn you.
It's really nice.
Yes, and so as you see, I'm going to go ahead and put a few more lines here. Now, she's the perfect example here. She is Hispanic. She has medium to dark skin tone. And you can see how well that YAG laser works on her darker skin. The gel acts as a conductor. It helps the heat travel through the skin without heating the skin or burning the skin. Then that energy goes into that second layer of the skin and is attracted to that hair follicle and will damage just that hair follicle. So that's a big deal when it comes to laser hair removal, because when we first started using lasers, we weren't able to treat darker skin types. So that's very exciting.
What if you have gray hair or blonde hair? Will this be effective on blonde or gray hair?
That is a wonderful question. So like I said, the energy of the laser is looking for melanin, is looking for that pigment. So when you don't have that in the hair follicle, it won't find it, it won't detect it. So usually lighter hair, people with lighter hair usually will try electrolysis. So if you're really blonde, you have that, you don't want to wait till your hair gets gray. Come in as sooner than later is better. So you see I'm being very careful to avoid that tattoo.
If you happen to touch the tattoo, what would happen with the tattoo?
It will burn the pigment in the tattoo, the color, so I could damage the art. and I could scar the skin. So you most definitely don't want the laser to touch the tattoo at all in any way.
Well, it's really interesting that you shave the day before, unlike what we've been told previously that you need hair to show for a hair laser treatment.
Yes, well, and some people do feel, you know, that they need to show me where that hair follicle is. So usually the consultation is a great time. If you feel that you need to show me where the hair is on the area that I'm treating and how coarse it is, you can come in for a consultation. I'll look at that area for you. We'll discuss what your concerns might be. And then we can set up your treatment for another day when you can come in shaven and ready. Whenever we treat the face, I most definitely like to make sure to tell people don't use any retinol or any kind of glycolic acid, salicylic acid, benzoyl peroxide on the face, or any kind of acne topical medication. Those things are very important because you don't want the skin to be compromised. You don't want to cause any kind of burn. So usually I'll tell people to stay off those topicals for about a week. And as you see here,
How you feeling, Alina?
Good.
Yeah,
It was
you're
a little-
laughing. Is it tickling you?
Yes, it was tickling me by my knee.
yes. So that is the process with laser hair removal. I will do the back of her leg and the other leg as well.
Okay.
Do you have a
I
question?
Another follower just chimed in and said, how many treatments does an area usually need when it's for a face, for example? How many?
So normally you're going to get about 85% reduction with 6 treatments. And so that's a very good reduction. Some people more, some people less, but the average is about 85% reduction. With your face, you have to take in consideration genetics, you have to take in consideration hormonal shifts and different issues, medications that we take sometimes. Even vitamins with biotin will cause hair growth. So you want to keep those things in mind. As some people with 6 treatments, they get that 85% reduction on their face and they're absolutely happy. Some people need more treatments. When we have different hormonal issues, that activates growth on the face. So 6 to 12 treatments, I think, is a pretty good number to give, but everyone's a little different.
Okay.
So.
Well, this is a wonderful. Thank you, Amy, for showing us this treatment of hair laser removal and how comfortable it is. And thank you, Alina, for
You're welcome.
being our model. And I see that it's comfortable and it's not scary.
Oh, yeah,
or
it doesn't hurt at all.
Or pinches or anything like that.
No.
Now, next week we are doing a live stream with Dr. Michael Baumholtz
Oh,
and Dr.
awesome.
Delia Ortegon, and we're going to talk about breast. The difference between silicone and saline, and under the muscle and over the muscle, and all the questions you may have. That is the time to tune in because we're going to answer every one of them
Oh,
live.
that's awesome. I didn't
Yes.
know that. So yeah, okay, so we'll have a breast dog consultation with Dr. Baumholtz next Wednesday. Thank you for spending your spring break with us, and we look forward to seeing you. Have any questions, please give us a call to set up a complimentary consultation, 210-614-4320, and we'll see you soon. Thank you for tuning in.
Bye, guys.
Bye.